Good morning to all of you out there. Welcome to the program agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV, Channels 8, and on Channel... If at first you don't succeed, try and try again. Good morning. Welcome to the program agenda here on Signal TV channels 8 and 250 and on facebook.com/onenewsph and on YouTube, One News PH. And if you can, download the Signal Play app so you can watch us on the go. Okay, good morning to all of you. I'm your host, Cito Beltran. Welcome on board. Parang eroplano na po, no? Medyo sumabit ng konti kanina. I think it was probably StreamYard or something. Hopefully, just give me a confirmation out there if we are okay. Today is April 23, 2021. It's a Friday and thank God we made it to another Friday. Medyo maganda po yung umaga ko kahapon. Maganda yung araw. Maganda yung araw ko kahapon. And today, I pray and it promises to be another good day because just to make you feel good, hopeful, our senior pastor here in Lipa City for Victory Christian Fellowship, Every Nation, si Ricky Vistan, he landed in the hospital late March for COVID-19. And struggle po yun. It was such a difficult, really days and weeks of trial. And every step of the way, pagsasabihin ng mga experts na, naku, ganito po mangyayari, naku po, malubha po, naku po, baka ma-intubate. I know that there were hundreds, if not thousands of people praying and constantly praying. They created the prayer chain. And you know what? He's home. Okay na. Aba, kahapon, nung hinahatid ng ambulansya, pakaway-kaway pa, akala mo beauty contestant. And I'm just sharing this so that many of you who might have family in the hospital or struggling, daan po ninyo sa dasal. Because as family members, as friends, we can't medicate, we can't play doctor, but at least we have one more powerful weapon, a weapon even doctors and nurses rely on nowadays, the power of prayer, praying to the Almighty God, our Father. Okay, so shinare ko lang po yun. And by the way, speaking of magandang araw, thank you very much to Director Vilma Di Maculangan of the Department of Agriculture dito po sa Lipa City. May office sila. Napakabait po nitong si Director kasi tinulungan niya ako, nagsusource ako ng mga cobra chicken. Hindi kayo nakadinig nun, ano? Cobra chicken. These are chickens where they don't have feathers in the neck. Ginagamit ko po yon for crossbreeding with my chicken, with my poultry chickens, yung mga layers, ganon, pampatibay ng kanilang resistensya kasi maganda yung hybrid. Natulungan ako and it just gave me an idea that perhaps if Secretary Dar and his people are watching in the national office, maybe you can create a system where Filipinos can call. Parang, good morning, this is the Department of Agriculture Assistance Program or Resource Referral Center. Yung ganun ba? Para saan po ba makakakuha ng buto? Paano ba makakakuha ng ganitong manok? Saan po ba makakakuha ng Peking duck? Etc. Kasi marami pong Pilipino kaya namang magpalaki ng hayop, halaman, etc. May kakulangan lang ng access to information, lalo na on a provincial setting. Now, if you have provincial or city or municipal agriculture officers who are accessible by Facebook or by mobile, malaki pong matutulong ninyo kasi we can do the work but we need the resources. Hindi po kami nanghihingi information. Si Director Vilma Di Maculangan, malaki pong tulong ang ginawa niyan. Okay, let's go to today's topic. Today we are going to interview two individuals. One is Congresswoman Angelina Helen Pan of the 4th District of Quezon kasi, excuse me, may hika pa rin ang kuyang but I'm feeling better. Doon sa mga nag-alala na pati sa Amerika may tumawag, Kuyang, how is your oxygen level? Okay na po. Yan ang pinagbabayarang kasalanan ng kabataan na yosi ng yosi. Anyway, okay na ako. We will speak with Congresswoman Tan because first time we interviewed her, medyo bitin. Hindi namin napag-usapan lahat yung health situation, healthcare situation in the Philippines. And after Congresswoman Tan, we will speak with the regular here on agenda, Dr. Jaime Almora, President of the Philippine Hospital Association. Kasi may sinabi si Doc Jim na Kahit naman damihan namin yung pasilidad, wala namang tatao. Pag-usapan po natin yan. But before that, let's go to the news on the front page. It's 8:09. Here are the stories on the front page of the Philippine Star. Ayan po, ang Philippine Star. Hospitals in NCR Plus commit more ICU beds. National Task Force Against COVID-19 Deputy Chief Implementer Vince Dizon says hospitals in Metro Manila have committed an additional 170 intensive care units or ICU beds and more than 1,000 ward beds. Dizon says these beds may be available by next month. Let's discuss how private hospitals play a role in this matter when we interview Dr. Jaime Almora. Next, in other news, lawmakers from both the Senate and House seek to defund the National Task Force to end Local Communist Armed Conflict or NTF-LCAC or ELCAC. This as profiling and red tagging of the community community pantry organizers continue. Yan po kasi magtataka kayo ang balita ko po, billion daw. Billion I hope I heard wrong. But apparently they have a 2 to 3 billion fund ba yun? Kung pinamudmud na lang yan sa probinsya, doon sa 20 poorest provinces in the Philippines, sinabayan ninyo ng mga baboy, pangtanim, abono, baka mabawasan yung mga rebelde. Kung yung pinamimigay na pagkain, babakbakan ng militar nitong LCAC na ito, babakbakan ninyo tapos magsasara. Lalo, you have become, ito lang po, the NTF-LCAC at the rate they're going has become the primary recruiting agency for rebels. Okay, let's move on forward. And the palace says President Rodrigo Duterte won't be able to attend the Association of Southeast Asian Nation or ASEAN Summit. Palace cites the face-to-face nature of the event as it explains the president's decision to skip the convention. The Department of the Foreign Affairs will represent the Philippines to the summit. Okay. Mahirap nga namang mahawa, Kasi 70 plus na si presidente, baka mahawa. At saka baka makakantsawan, mapintasan, kasi best friend niya yung China. May mga tao doon sa South ASEAN Summit na nagsasabing, kami pumapalag. Ikaw sumasaludo. Anyway, let's move forward to our topic for today. Basahin ko lang po. Allow me to read some information, some background material on the state of health in the Philippines and concerns in the health area. Here we go. House Committee on Health Chairperson Angelina Helen Pan says that the speed of vaccine rollouts is far from ideal. Okay. House Committee on Health and Trade Industry are looking into the steps that the national government or DOH and NTF is taking to ensure supply of vaccines and distribution. Okay. Congresswoman Tan says we cannot afford to delay the vaccination program. The people's right to health cannot be compromised. The vaccination program is critical in reinvigorating the Philippine economy and our life as a nation. Ito po. World Health Organization Philippines Representative Rabindra Abeyasinj says we are still short of protecting all the frontline healthcare workers, and the current surge demonstrates that we need to have healthcare workers fully protected so that they can work to care for the sick and help them heal, unquote. Okay. As of April 17, 960,191 health workers have received the first dose, while 191,982 had been fully vaccinated according to the DOH. So medyo kalahati pa lang kasi sabi nila noon 1.8 million health workers need to be vaccinated. Since March 1, 1.26 million Filipinos have received their first dose. DOH Undersecretary Mirna Kabutahe says around 54,000 individuals, health workers, seniors, etc., had decided to defer their vaccination. Okay. Ito po, no, medyo marami pa dito. Yung tungkol naman sa nurses, ito po, medyo baka mag-isip kayo, no? According to a report from CNA, okay, Philippines facing nurse shortage despite being the world's top source of nurses. 2 in 5 who pass nursing examinations go abroad. Nurses hit by COVID-19 given only rapid tests by employers. Okay. Some underwent RT-PCR only after showing severe symptoms. A nurse in Manila who had been working for 14 years is only earning 630 pesos a day, just 145 pesos above the minimum wage. Ha? Konti lang ang angat niya sa pahinante. Okay? Filipino nurses in UK can earn up to 2,250 pounds or more. Okay, Gab, thank you for that note. Ready na raw si Congresswoman Tan. Okay, and or 150,000 a month. Sa US, up to 8,000. Medyo, bakit ko po binabasa ito? Kasi kailangan ninyong malaman itong background na ito. Sana nga, nagawa na lang namin parang docu or report, no, synopsis. Kasi medyo yan po nagiging issue ngayon. Kapos na ang nurse kasi naglalayasan yung iba. Sabi, kamamatay ko lang ito, wag na. Mabuti, yung yung nurse daw ang minimum pay under the Nursing Act, dapat 33,575 a month. Pero mo, tiga-punas kayo ng wet po ng pasyente, tiga-punas kayo ng katawan ng kung sino-sino, tiga-angat, tiga-buhat, tiga-turok, etc. Ganun lang ang makukuha mong sweldo. 33,000. Kung may itsura ka, di ayun, katulad nung na-interview namin dito, flight attendant na lang because the flight attendants, at least before COVID, kumikita 40, 50 mil buwan-buwan. Ang servidor lang sila ng pagkain. Hindi sila tiga-punas ng wet po. Okay, let's go to our first guest, Congresswoman Helen Pan. Pasensya ka na this morning, Kong. Good morning, ma'am.
Yes,
okay. I told you naman, we will have a to be continued, a part 2 sa ating interview kasi talagang pareho naman tayo, ang puso natin is in healthcare and the well-being of Filipinos. Now, with the supplies that the country has, what made you say that the country's vaccination program is slow? I mean, napaka-obvious no? Pero gusto ko lang malaman. Kasi hindi ba in-interview ninyo itong mga tiga-National Task Force, itong IATF, etc.? Ano ba nangyari doon sa hearing ninyo sa Congress?
Sir, actually, nakita naman talaga natin na yung target, sinasabi nila, every day they've been targeting at least mga 300,000 ma-vaccinate nila per day. No? So in a week, ang sinasabi nila 1 million. But in reality nga, hindi naman siya nangyayari kasi number one, maraming problems in the ground. Identify na natin ito long before dumating po yung vaccine for them to be proactive and aggressive in the campaign so that pag dumating po yung bakuna, ay ready na ang mga mamamayan. So marami po tayong mamamayan ngayon na ayaw talagang magpabakuna. No? Ako personally, kahapon lang po, maghapon, umiikot po ako sa mga barangays at nakikipag-usap sa mga senior citizen kasi nagkaroon po ako ng meeting sa lahat ng municipal health officers ko dito sa aking distrito. At ang feedback nila, talaga pong ang hesitation, no, yung resistance nila to get vaccinated. Doon pa lamang sa frontliners, BHWs, no, or members of the Barangay Health Emergency Response Team.
Mm.
Um, may delays na po doon, no, kasi you have to give time doon sa pag-convince, and part of their policy, kailangan, sir, merong attestation ang isang municipal health officer na nabakunahan na niya yung lahat ng kanyang frontliners bago siya makaproceed sa next step, which is the A2. Kaya nakita
Mm.
niyo, sir, yung delays. So, sabi nila, ang hirap, ma'am, kasi hindi kami makakapag-decide on our own. Nakailang beses na kami ng orientation sa mga health workers. Then, they have to give time din, no? Hindi naman pag sinabing ayaw, talagang totally papipirmahin na nila ng waiver. Na ayaw po talaga nila kasi kinakailangan po yun eh. So,
Mm.
parang yun yung justification nila sa DOH. For them uh, to give additional vaccine din. Hindi din sila makakakuha po ng vaccine nang wala pong mga certificates galing sa municipal health officers. So, I think doon sa sistema, masyado po siyang hindi siya flexible sa ating mga implementors.
Mhm.
Kasi ang daming, like for example, sir, ang dami ng senior citizen, halimbawa na ready pa magpa-vaccine, but dito sa amin, sa probinsya, hindi pa siya scheduled to give vaccine for seniors kasi hindi pa natatapos ang frontliners. Parang ganon. And then,
Ah. Mhm.
di ba, sir, sobrang nakaka-delay siya ng implementation. Kasi ang thought ko, sir, yes, we have limited vaccine. Napaka-limitado. That's the reason why we prioritize, no? Meron tayong mga lists. But ang goal natin is to expand the coverage. Hindi po ba? Ilang
Mm.
porsyento ng populasyon ang gusto nating mabakuna sa loob ng 1, 2, 3 buwan. So ang thought ko, kung nandyan na i-present na sa frontliners, ayaw, proceed. Kung ayaw ng next list, proceed. Parang
Mm.
ganun, proceed ka ng proceed, and ibigay mo siya doon sa mga tao that really want to get vaccinated. No?
Kumbaga kung ayaw mo, di wag.
Something
Punta
like that.
punta ako doon sa may gusto because this is a national problem. Maraming nagsusumbong po sa akin ng ganyan na ang daming takot. Kaming mga gustong magpabakuna, hindi naman kami kino-call up, parang unahan or waiting.
Yes, tama, sir. So, parang as long as you're a Filipino, you have that right, no? 'Di ba? May
Mm.
karapatan ka doon sa bakuna bilang isang Pilipino. So, nagkataon nga lang po na nagkaroon ng priority lists. But
Mm.
for example, sir, teachers, yung mga guro, gustong-gusto na nilang mabakunahan, but nandoon pa lang po sila sa dulo, sa B1. So, um, parang naghahabol tayo sa oras na nahihirapan din ang ating implementers in the ground na mag-decide kasi natatakot sila na sila'y
Okay.
marereprimand because na-violate nila yung sinasabi ng ating task force.
Kumbaga, pag sakit sa ulo, it is we will leave it to the LGU to decide pag
Yeah.
masakit sa ulo. Pero pag kailangan desisyonan ng LGU, we have to ask permission from the task force. So kumbaga parang hindi mo malaman kailan ba talaga may karapatan yung LGU at kailan sasaluhin ng LGU. In any case, Congresswoman Tan, matanong ko lang, na-imbestiga ba ninyo, nasiyasat ba ninyo sa Congress nung hiniring ninyo? Did you find out the timeline, the process of getting the vaccines? Kasi it's strange. It's really strange that we haven't even, I don't think we've even reached 5 million vaccine doses on the ground. Ang alam ko lang puro donation, and yung pinaka-latest na 500,000, yung pa lang yata yung una ng binili talaga ng gobyerno. Ang tanong po ay, tayo ba ay walang bakuna because the world market and the superpowers are controlling the flow, or because we were too slow and too late in making our orders? Kasi natatandaan mo, nagbitaw ng salita, dalawang government officials no, nagsabing, somebody dropped the ball.
Tama sir, last year yon, no? Si Secretary Galvez sir, yes, napag-usapan po yon. Since nung January na before po tayo nagkaroon ng vaccination, nagpatawag po ako ng briefing ng roadmap ng vaccination program natin. So may pinresent sila doon na timeline. Unfortunately, hindi po na-achieve yon, no? Kung kailan yung first delivery. But yung last hearing po namin ay nakapag-present naman po sila kung ilan yung mga darating, which he's saying medyo confidential yung negotiations on the numbers of the vaccines na inaasahan po natin. So they were saying may darating by mga March 2021, may sinasabi sila na target nila ay Moderna, baka may dadating po na Moderna, at AstraZeneca pa, meron ding darating, and the Sinovac. So ito po yung mga binili natin, I think, kasama ang private sectors and the LGUs. And then, meron din siyang sinasabi na may darating galing sa COVAX facility, but hindi po masabi kung ilan ang numero, no? Kasi kung kailan lang siguro sabihin po ng COVAX facility na magdi-deliver and how many yung kanilang i-deliver.
Okay, so we'll go for a quick break, Congresswoman Tan. And when we come back, tuloy po natin ang usapan tungkol din sa naging hearing ninyo and the state of our healthcare. Because isa pang pinoproblema, dinidiktahan ng national government yung mga private hospitals na lapara o damihan yung kanilang bilang or number of COVID wards and beds, COVID beds. May mga pumapalag na kasi sabi, we did not go into business na para saluhin yung kakulangan o pagkakamali ng national government. Let me go for a quick break here, and when we return, please address those concerns. We'll be right back here on Agenda. Welcome back to the program Agenda. I'm your host Cito Beltran, and you are watching us from from Lipa City live, brought to you by Signal TV channels 8 and 250 and PLDT home fiber internet. Bago po tayo magpatuloy, magpapasalamat lang ako kay Attorney Regalado Eusebio or Attorney Reggie, retired judge of Imus Cavite, owner of Lihim na Kubli Farm and Resort, Barangay Guyam na Malaki, Indang, Cavite. Kakaiba talaga yung mga tiga Cavite, no? Lihim na Kubli pa, pagkatapos Guyam na Malaki. Dito Guyam, sinusunog natin yung Guyam dahil masakit mga gat. Thank you for helping me access the birds and geese that I have long sought. And then of course, kanina po binati ko na pero mali pala yung aking pagkabati. Kasi si Ma'am Vilma Di Maculangan pala ay ang OIC, Officer in Charge, Regional Executive Director. Taas pala ng posisyon, ginawa ko lang director. Dati ang hilig ko mag-promote, ito na-demote. OIC Regional Executive Director ng Department of Agriculture for Calabar Zone. Okay, let's go back to our guest, Congresswoman Helen Pan. Kong Tan, good morning ulit. And ma'am, natatandaan ko, before you became Congresswoman and got into the Health Committee, I know that you were involved in running a hospital. It was a family thing. What do you have to say about this situation where the national government is now telling, especially in Metro Manila, oy, dagdagan pa ninyo yung inyong mga COVID wards, etc. And may isang doktor nagsabi sa akin, alam mo Sito, mali yan eh. Kasi dapat last year pa lang, ginawa na nila yung sinasabi nating nagtayo ng additional hospitals. Parang pinapasa ng National Task Force and national ng DOH yung dapat responsibilidad nila, pinasa nila ngayon sa mga hospital owners. Anong masasabi niyo?
Well, sir, I agree, no? Kasi from February last year or January, since we learned na merong problema dyan sa coronavirus in China, dapat ang bilis lang. Ang natatandaan ko, sir, ang nasabi ko in one of the interviews before, sana yung preparation natin overkill, no? Whether dumating ang maraming kaso sa atin o hindi, nakapaghanda tayo. And last year, from March to December, ay binigyan naman tayo ng panahon, no, para makapaghanda, makapaglagay ng mga convertible tents or mga buildings na lagyan ng mga hospital beds or i-convert into ICUs. And hindi nga natin na-reach yung red line, no, yung critical stage last year. And parang siguro tingin ko dahil para bang buwan-buwan tinitingnan lang natin ang kaso, and then ang naging attitude nila kung tumaas, that's when the time they will act on it, no, on the need. So ang naging problema, sir, last year, we have all the time to prepare, set up mga expansions of the hospitals. Like for example, in NKTI, nagawa ng hospital nakapag-expand, pero sana natulungan pa rin ng national government na makapag-expand pa dahil may lugar na paglalagyan ng more tents, no? Lagyan ng mga ICUs or expand pa yung kanilang emergency rooms. Other government hospitals, yung ating specialty or DOH retained hospitals, provincial hospitals, regional hospitals, district hospitals, lahat po yan ay pwedeng na-expand at na-prepare na natin last year. Ang nangyari nga, sir, dahil nga yung ating kaso ay nanatili na nandun sa 3,000, 2,000, 4,000, parang tumigil din, no? Ang inilagay lang mga isolation facilities. But ang problem nga, merong mga malalaking isolation facilities na inihanda, kung I'm sure you're aware of that, no? At hindi naman nagamit kasi hindi rin naman magamit dahil wala din malayo, tama po kayo, hindi strategically located, and wala din tao po, hindi naging malinaw sino bang magpapatakbo nitong isolation. So
At saka nakikigamit, 'di ba? Parang yung Philippine Arena, nakikigamit lang tayo doon, etc. Sana nakapagtayo na tayo ng sarili natin.
Tama, sir. So noon pa man, bagaman sinasabi natin nandoon ang hotspot natin ay NCR, ay napakahalaga na naihanda natin yung mga nearby provinces. Dahil alam naman natin mag-spill over yan. So ngayon, na tama po kayo, yung observation ng kaibigan nyo na ang kakulangan ng gobyerno ay ipinapasa sa pribado, which is very hard also for private hospitals dahil alam naman natin na ang bulk of the manpower ay nasa government po. Sir Cito, long before dumating ang pandemya, malaki na po at malalim ang problema natin sa health workforce, no? Napakalalim na po yan. At na-mention nyo, I was in the operation of a hospital before. I'm a medical director before.
Yeah.
At napakahirap kasi the private is competing sa ating government when it comes to salary. Hindi talaga mapantayan yung reality kasi kung taasan mo ang sweldo, that means you'll also increase the cost of services just to cope on the operation, hindi ba? And alam naman natin, di natin po pwedeng basta gagawin yun dahil we are being regulated by the government. So kaya noon, Sir Cito, pag nakikita ko ang DOLE na nagsasabi, they're promoting nurses going to Russia, to Germany, or anywhere, I feel sad.
Okay.
Kasi alam ko, yes, opportunity for mga nurses yon or our allied health workers. But anong kampanya ang ginagawa ng gobyerno
Okay.
para manatili dito ang ating mga manggagawa sa kalusugan?
Ako na po sasagot, wala. Sorry, no, but you know, after saying that, I want to ask you, Congresswoman, kasi I'm a problem solver. I cannot sleep unless I solve a problem. Now, itong situation natin, you have a private hospital. In the absence of more hospital facilities, government is now leaning on private hospitals. But the problem of the private hospitals is they cannot pay the salaries that government hospitals and foreign hospitals are paying. So I would say, dapat may subsidy. Hindi ba pwedeng gumawa ang system? Kasi ikaw naman ang congresswoman, wala akong alam sa paggawa ng batas. Hindi ba pwedeng gawin where the PhilHealth subsidizes a portion of the service delivered by a health worker, whether it's a doctor, medtech, nurse, etc. Kumbaga, kasama daw doon sa package yung pangdagdag, pangsweldo ng bawat nurse na magtatrabaho. Kumbaga, it's not a lump sum, o sige, ayan Helen, sa'yo na yan, bahala ka ng gastusin. It is more of a, nagtrabaho si Dr. Helen, okay, then ito yung portion ng fee mo sa subsidize ng PhilHealth or ng government. Kasi if not, balita ko nga from Mayor Joy Belmonte kahapon, may mga hospital nang binebenta for sale na dahil nag-give up na yung mga may-ari. Sabi, wala. We cannot run company like that.
Tama, sir, no? Either yung PhilHealth po can expand their coverage, no? Or pwede pong ang gawin ng gobyerno, which I explored already sa region po. Excuse me. Yung ating mga private hospitals, like dito in Quezon po, I was exploring na makapaglagay po ng ICUs, no? Yung mga convertible tents. And ang partner natin is private hospital. So I talked to one of the medical director here in Lucena City and to DOH regional director namin na kung willing sila, supervision, but ang DOH po ang maglalagay ng manpower and supplies, no? But the doctors will be willing to help, no, overseeing or taking care of the patient. Dahil nga tama po yung binanggit nyo, wala po talaga kahit na may available beds and if even if willing ka na talaga namang i-expand, ang problema, sir, masasacrifice naman po yung kalidad ng serbisyo na maibibigay mo sapagkat walang sapat na tao, no, especially nurses natin. So ang pwede, sir, yung partnership is that if ang isang hospital, private hospitals ay merong available space, no, an ICU, the government can run it, provide the necessary manpower, nurses or additional doctors if they have, no, and then ayun, parang partnership siya, no, susuportahan kasi ang yung iniisip niyo po kanina na can PhilHealth, napakalaking issue po kasi every step na gagawin ng PhilHealth, parang minsan yung expectation mo na dapat ginawa nila, hindi naman yun ang nangyayari. So maraming problema ang PhilHealth pero ayoko nang umasa doon sa gagawin ng PhilHealth dahil yun nga ang clamor ng private, hindi nakakabayad on time, even in government hospital. Hindi po nakakabayad ng nasa oras. So I think it's more of explore ng DOH yung partnership in a sense na mag-provide po sila ng manpower, ng supplies, medicines, and everything to
Okay.
use the facility.
Can't you legislate it, Congresswoman Tan? Because I think we give too much credit to the leadership of the DOH and the National Task Force. Na parang sana gawin nila ito, sana gawin nila. Hindi nga nila nagawa yung mga hospital when they had the chance. Inuuna pa natin yung mga tulay, mga airport at kung ano-ano, pero yung hospital walang ginawa. So can't Congress, can't you and your associates come together and say, if you won't do it on your own, we will pass laws to force you to build this and to do certain adaptations or policies?
Actually, sir, ang dami na natin na existing legislations, no? Ah, ah, may mga batas na. Like for example, expansion of all the government DOH retained hospitals and provincial hospitals on the bed capacity. When you expand the bed capacity, that means you construct another building to accommodate a certain number. And this is based on the historical data ng admissions or the operations of each of the hospitals. Yung 3 years operation nila, nakikita nila how much more beds do they need. And nandyan po yan but unimplemented. No? Yun yung,
Aha.
yes, pwede po kaming gumawa ng batas again, i-task namin na gumawa sila ng more buildings or establish or construct new hospitals doon sa mga areas natin na nakita natin na nangangailangan. And yan po lahat unimplemented. Ang ating East Avenue, meron na po tayong batas pero hindi po yun na-implement. Rizal Medical Center, meron na po tayong batas. Ako po ang chair ng last Congress, kaya alam ko kung gaano kadami na mga naggawa natin batas but unfunded. So ako ngayon, nasa katatayuan, Sir Cito, na yung batas ba ang sagot doon sa problema? Kasi kailangan po talaga ng right people. I think it's more of tamang tao para yung may malawak na pagtingin, malalim na pagtingin and may political will for these things na ma-address po yung problema even without pandemic.
So, so in terms of laws, you have made all the laws so that all of these buildings, structures, facilities can be put up, but obviously it has not been funded at hindi pinapatupad. Yun po yung sinasabi nyo.
Tama, sir. Yes po. And we can check that, no? The unfunded laws. Napakadami niyan, sir. Even, for example, sir, napag-usapan natin last na tayo pinag-usap, yung Universal Healthcare Law is a health reform law. With the pandemic, tinanong ko po sa DOH yan. I know, naiintindihan ko, overwhelming po yung problema natin sa pandemic. Meron ba mga provision doon na doable? Pwede natin gawin while we are addressing these problems ng pandemya, no? Yung problema natin ng health workforce, nakalagay po doon. Problema natin sa pasilidad, nakalagay po doon. Affordability of services, nakalagay lahat doon. Taong titingin for each of the Filipino, nakalagay naman doon. So, hindi ko rin po alam. Ako, every now and then, I've been coordinating with DOH, asking ano na ang progress, ano na ang nangyayari with all the problems na meron po tayo. The most that I can do is always ask, tutukan and check kung may ginagawa ba sila.
Okay. Well, thank you very much, Congresswoman Helen Tan.
Thank you, sir.
And I know that you won't stop. Hindi nyo titigilan yan at sana po magtulong. And I hope that the people in charge or are responsible understand that it's nothing personal. Wala naman po tayong personal na agenda dito. Kanya lang, talagang nakakaawa na yung mga mamamayan na sa tent na ginagamot. Thank you very much,
Thank
Congresswoman.
you, sir. Thank you po. Good morning po sa inyong lahat.
Okay, yan po si Congresswoman Angelina Helen Pan, representative of the 4th District of Quezon Province. And let's now go to the President of the Philippine Hospital Association, Dr. Jaime Almora. Dr. Jimmy, good morning.
Good morning, Cito. Good morning to our viewers.
Ikaw ba nasa Apari ba yun?
Tabuk City, Kalinga.
Nasa Tabuk, sorry, nasa Tabuk ka pa rin. Matanong ko lang, Dr. Almora, dito sa Metro Manila, mukhang pumayag na raw yung mga hospital magdagdag ng 1,000 more COVID beds and for their ICU and their wards. Ngayon, and that mangyayari na raw yan within a month. Nagtataka lang ako dun sa statement na yun, Dr. Jim, because ikaw ang expert, no? Pakituruan mo na lang kami, baka naman mali-mali lang ako. Hindi ganun kasimpleng gumawa ng isang ICU cubicle. Kasi I spent half a month with my mother in the ICU of the NKTI. Pag pinapanood ko lahat ng mga equipment, monitors, mga linya, etc., just for one cubicle, sabi ko, nung sinabi nilang 1,000 beds, sabi ko, nahihibang na ba itong mga taon to na akala nila ganun kadaling magtayo ng ICU? Dr. Jim, what is your response?
Tama ka dyan, Cito. Ang hospital ang isa sa mga pinaka-complex na institution. Actually, yung mga architect nga, yan ang dream project nila, mga hospital, dahil talagang pag nakagawa ka ng hospital, talagang magaling ka dahil napaka-complex. So, mahirap talaga mag-set up. Yung sabi na willing mga hospital magtatag, sa mga government hospital siguro, mukhang may ginagawa naman sila pag i-expand. Pero sa private hospital, wala pa ako narinig na private hospital na nagsabi na mag-expand. In fact, yun nga problema na automatic sana na response ng mga hospital ay mag-expand. Pero there are factors and a confluence of factors that is preventing the hospitals from doing this.
What are these?
Ito mga factors na ito, let me identify them. I call them, naging complex na masyado itong problem ng mga hospital, especially sa private hospital. Pero kasama na rin ang government hospital dito sa ibang problema. Number one is yung personnel, which I call it personalitis. May sakit ang hospital sa personnel, manpower kulang. I will go to that later. Second is yung financial. Tawag ko dyan financialitis. Okay? May sakit din sa finance. Third dyan na problema ay yung mental health ng mga workers, doctors, and nurses. Mayroon yung fatigue syndrome na. At saka number 4 na problema is yung policy disconnect ng DOH, IUTF at saka PhilHealth. Nagkakaroon ng disconnect yung mga ini-issue nila na AO, saka mga administrative orders, saka mga circulars, especially between DOH and PhilHealth. So, you would allow me,
Okay. Let's do it this way, Doc Jim. No, we'll go for a very quick break, 1-minute break. When we return, I'll give you all the time to go through all these ITs that the private hospitals tinitiis yung ITs. Okay, we'll go for a quick break. We'll be right back. Okay, you're back here on Agenda. I'm your host, Cito Beltran. With us is Dr. Jaime Almora of the Philippine Private Hospitals Association, Philippine Hospital Association of Philippine Hospital Association. Ewan ko na nga ba. Doc Jim, sige, please, paki-explain nga sa amin lahat ng mga ITs na tinitiis ng inyong mga ospital.
Okay, mag-start tayo sa personnelitis. Personnel. Both dito, ang problema is yung shortage ng nurses at saka kasama na rin ang doktor dito. Ang alam naman natin na pag-usapan yata natin nung last time nito na nagsimula ito bago pang pandemic, mayroon na tayong problema sa personnel, sa nursing personnel. At saka kahit doktor noon. Nasabi na ni Congresswoman Angelina kanina yan. And this is a result of yung pag-phase out sa mga nurses school. Alam natin, exporter tayo, pinakamalaki tayo yung mga nurses natin nagtrabaho noon kahit walang sweldo para lang magka-experience, para mag-abroad. So dumating tayo sa punto, nagpo-produce tayo mga nasa 50,000 yata yung mga ganun, produce natin noon. So nangyari, dahil sa dami ng mga nursing school, maraming mga nagbukas na hindi maganda ang performance ng mga graduates nila. So, maliit ang passing rate for exam. So, ang ginawa ng CHED, nag-phase out. Phase out niya yung mga iba. So, kumunti yung nursing school at kumunti na rin yung nursing graduate dahil doon sa kataasan ng demand noon at nung bumaba yung quality, napuno na rin yung export market natin. So nag-slow down yung hiring. Remember, pati mga doktor noon kumukuha ng nursing para lang makapag-abroad.
May kaibigan ko, doktor sa lung center, kumuha ng nursing, nag-nurse abroad.
Kaya yun ang nagpaliit ng supply natin din ng mga doctors. So na dumating yung time na bumagal din, kumunti na rin yung mga nursing graduates dahil kumunti yung demand. Pero patuloy pa rin yung paglabas nila sa nag-open naman yung ibang market. So marami pa rin export. Dumating tayo sa punto, nag-export tayo ng 20,000 to 25,000 per year noong 2015. Sumunod naman dyan, kumunti na yung mga nurses, naghirap na, ay nagtaasan naman ng sweldo sa uniform services. Ayan. Tapos maglipatan yung marami sa mga nurses naglipatan sa uniform services. Ngayon ang PNP may 9,000 na nurses na sila doon. Ang Army marami na rin. At saka Bureau of Fire Protection. At ang yumaman ng gobyerno, kasi ang gobyerno yumaman eh. Nagbukas ng maraming mga employment opportunities. So napunta rin marami itong mga nurses napunta dito sa mga other employment opportunities na not necessarily related sa nursing. Okay, so moving forward, dumating itong K-12 program. Ito yung isang dahilan kung bakit wala tayong graduate starting 2020. So, ang next graduate na expected natin ay sa 2022. Pero 1 year na walang mag-graduate, dahil 1 year na nag-pandemic, so madidelay yan ng 1 year. So sa 2023 pa. Magbo-board exam pa yan, so ready for employment na yan sa 2024 pa. So yan ang other topic na discuss natin mamaya dahil that's very alarming situation sa outlook natin.
Doc Jim, quick question lang, Doc Jim, no? Sinabi mo maraming lumipat na nurse sa uniform services. Ang tanong ko lang, lumipat, lateral transfer ang tawag doon eh. Lumipat ba sila as nurses and doctors o lumipat sila doing soldier or whatever, kumbaga non-medical related application and position?
Nag-expand sila ng medical application pero mas marami pa rin yung non-related as ordinary policeman kasi napakalaki ang sweldo eh. Okay.
Cool. Okay.
Yan nga.
So going back, sinabi mo yung mga nag-K-12 tayo, humaba ang aralan. So by 2023 pa makaka-expect ng bagong batch. Okay, so moving on.
So patuloy pa rin naman yung pag-export natin dahil nag-open up na 'yon ang export market. Ang Canada massive recruitment sila. Other countries na rin dahil dito nga sa pandemic kailangan nilang mga nurses. Ang mga nurses natin na-expose rin lang sa COVID. Bakit hindi na lang tayo pumunta doon sa mas malaki ang sweldo? So, yan, na-decimate tayo. And then, dito nga sa nangyayari, yung mga nurses natin nagre-resign sa ospital by peer pressure o family pressure. Mga isa nagre-resign dahil sa takot. Yung karamihan ngayon at padami na ng padami, yung mga nasa isolation room na ng mga nurses, sila na yung na-isolate. Sila na yung nag-occupy ngayon sa mga ICU at saka isolation room.
Sila na yung pasyente.
Sila na yung pasyente. At hindi lang sila, yung mga kasama nila, na close contact nila, naka-quarantine na rin.
Okay. Last 5 minutes tayo, Doc Jim.
Okay.
Ang tanong lang kasi alam na natin lahat siyang ITs na yan, pero maganda na in-explain mo kung bakit tayo may shortage, no? Now, ano pa yung iba? Yung finance, yung policy, quickly na lang.
Financial, walang bayad ang mga ospital pa sa galing sa PhilHealth. Maraming dinideny at saka hindi rin binabayaran since they start. Nag-usap naman kami ng PhilHealth, nag-promise magbayad, naglabas ng bagong circular, magbabayad ng 60% sa mga good claims. Pero may mga provision doon na hindi katanggap-tanggap sa mga private hospitals. So, hindi sila nag-apply kasi applyan nila yung pera na nila for collection nila. Pero alam naman natin may problema nga ang PhilHealth. Nung nag-start itong pandemic, sila yung unang tumugon. Nilabas nila yung IRM, which was a very good response by General Morales. Pero nagkaroon ng issue yan sa Congress, sa Senate. From procurement anomaly, napunta sa IRM na wala namang problema. In fact, we sympathize with PhilHealth dahil dyan sila nagkaroon ng maraming problema dahil sa IRM na tulong sa ospital sana na hindi naman dapat problema, ginawang problema ng legislation. Ngayon, maraming nag-resign, maraming na-suspend. So yung decision making sa PhilHealth kumunti at saka yung mga nagtatrabaho para sa processing kumunti na rin, and then marami ring mga nagkasakit sa kanila. So bumagal ang processing. Pero aside from that, meron ding problema na yung sa decision making, parang kagaya ito ginawa nilang circular, hindi katanggap-tanggap sa mga private hospital. So kailangan mag-usap kami ulit, at especially yung mga denied claims at saka
yung sinasabi niyong copay.
And then yung may provision sila na magkakaroon na bawal magkuhan ng copay, government and private. Hindi naman pwedeng magpalugi yung hospital, kaya paano naman tatanggap ng pasyente kung
sandali, ano ba problema doon sa copay, Doc Jim? Kasi parang yung sa copay ay ano ba problema? Kasi dapat zero balance billing. Dapat wala akong babayaran kung ako yung pasyente ninyo.
For example, mild case, Cito, 43,000. Sa PPE pa lang, aabot na ng 30,000. 43,000 babayaran, obligado na i-confine mo yan ng 14 days. So, paano aabot? Saan aabot yung 43,000 na babayaran sa mild case, sa 73,000 sa moderate case? Yung personnel mo, yung mga gagamitin mo, yung mga gamot, kulang na kulang. May provision doon na bawal sumingil ng copay. Ayun ang
bawal niyong isingil sa customer o sa pasyente yung area, yung sobra o yung mga hindi nasakop ng PhilHealth package.
Yes.
So ayan na naman tayo. Ang problema ay yung PhilHealth package, nangyayari, pinapasa natin yung problema sa customer, at kayo namang mga ospital, hindi naman din kayo papayag magpalugi.
Inadequate in the first place, inadequate yung PhilHealth package. So, kung hindi nila kaya, di okay lang. Pero payagan naman kami na yung pasyente na ang magbayad, yung excess para hindi naman malugi.
Pasensya ka na, Doc Jim, no? Kasi kakalabas pa lang nung pastor ko sa ospital, 1.6 million in a matter of 3 weeks. Parang ngayon magbebenta na sila ng gamit dahil lang sa haba niyan. Ang buong akala ko masasagot ng PhilHealth at saka ng medical insurance. Wala. Laylay din pala yung mga yan. Anyway, let's move forward to the policy conflicts, Doc Jim. Quickly, last 1 minute na. Pasensya ka na.
Yung policy conflict, gusto nga ng DOH na yung mga hospital, mga level 1, level 2, mag-open up, may order sila. Pero ang PhilHealth, hindi naman nila babayaran yung level 1. Pag mayroon daw ibang hospital na malapit yan na mas mataas ang level, hindi nila babayaran. At saka, yun nga, nagtithreaten na yung DOH na ididimanda ang mga hospital. Pero wala pa rin namang Yung hospital nga nagkakaproblema na, hindi na binabayaran, wala nang personnel. At saka yung sinabi ko kanina, yung mental health ng empleyado, mayroon ng threat. Kahapon may meeting kami dyan sa mga hospital dyan sa Batangas. Nag-threaten yung mga nurses doon sa ibang hospital na pag magtanggap sila ng COVID, magre-resign na lahat yung mga nurses. Ganon. So naiipit talaga mga hospital. Napakalaki problema dahil patig na rin yung mga nurses at ayaw na nilang magtanggap.
Mhm.
So
Okay.
yan ang
Okay,
confluence.
ganito, Doc Jim, babalikan kita. I promise you, next week, no, babalikan kita. Mas bulat-latin natin to kahit na isang oras tayong dalawa lang. Kasi I think this has to be understood by many of the viewers of Agenda. Thank you very much, Doc Jim Almora, for your time today. And I'm looking forward to talking to you next week, if you don't mind.
Thank you, Cito.
Okay, yan po si Dr. Jaime Almora ng Philippine Hospital Association. Marami po siyang na-share, marami kayong naintindihan doon, pero ito po ang problema, no? Nagkaroon ng depekto yung mga nursing school, phase out. So walang nurse. Nagkaroon ng K-12, sinusuportahan ko naman, pero hindi na-project yung magiging impact sa iba-ibang lugar. Pagkatapos, yung tulong ng PhilHealth noon na maayos, mabuti na politika kasi may konting anomalya sa ilang lugar. Kumbaga ito pinapatay yung kung ano yung solusyon, pinapatay yung solusyon dahil lang yung solusyon may pekas or may kakulangan or mali. Yan po, no? Parang masyadong the solution is always to phase out, to shut out, or to close down. And that's why we have problems today. We'll go back to all these topics next week. In the meantime, please take care of yourselves, stay healthy, relax na lang muna tayo this weekend. Ako, mag-aasikaso muna ako ng aking mga gansa, mga manok at aking mga vegetables. Kayo rin po, have a goal for the week, but make sure that this weekend you spend some time with the Lord, have a Sabbath with the Lord. Thank you for your time, for joining us. We really appreciate it. God bless.